Hello, everybody. My name is Sarah Bieberstein, and I'm a physical therapist at Spirit Winds. Thank you so much for joining us this evening for our talk on the multiple ways to use a tennis ball. So I'm going to share with you guys a couple of my favorite ways and a little bit of some creative ways to use tennis balls. So if you're participating along with us tonight, go ahead and grab a tennis ball, 2 tennis balls, and a stocking or a nylon or a sock, and then a pillowcase. We can go ahead and get started. All right, so how this evening is gonna go is I'm gonna describe to you guys a couple reasons why we can use tennis balls, the different ways that can benefit your body as a system, and then after we go through those, then I'll do some demonstrations for you guys to see where I'm placing things exactly. All right, so without further ado, here we go. So the first couple of ways that I like to use tennis balls is for trigger point release, which I'll talk about in a little bit, give you a little bit of background on that. And then the other way is for coordination related things. And so in regards to trigger points, if you guys have heard of them before, which you probably have if you've been in our clinic, we talk about them quite a bit. They're tight nodules within your myofascial layer. They can be hyper irritable, meaning that once you touch them, they might have a pain response with them. And then sometimes that pain response might elicit a jumping response. The muscle might twitch a little bit, and that just means that it is an active trigger point. Trigger points can also go by the names of knots, myofascial trigger points, but they all mean the same thing. So these trigger points are kind of controversial in figuring out what actually caused them and what they actually do to your system. There's lots of research out there throwing out lots and lots of ideas. But the general consensus between everybody is that these trigger points come from things like aging, injury, doing too much exercise, a lack of exercise, poor posture, chronic stress conditions. If you constantly hold your shoulders up to your ears, it's going to put your upper trap in a shortened position. That creates excess tension to the area, and then a node can possibly form there. And then also joint problems. If you have painful knees or hips, you might notice that you have a couple of extra tender points along your hips or your hamstrings or your quads. And so trigger points aren't all, kind of bad and sad news. Everyone actually has trigger points, even babies. So these are just things that occur naturally throughout our life. Whether you have one or not doesn't determine whether or not you will have any symptoms or soreness with them. But those trigger points can cause pain, like I talked about before, and that's when our friend, the tennis ball, can come into play. So a couple reasons why we want to release them is that number one reason, it can help relieve pain. And then the second reason is that active trigger points, so ones that are causing symptoms, those ones can have an acidic environment around them. So when a muscle is contracted for an extended amount of time, they create these negative chemicals around them that can cause an inflammatory response. So it causes more blood flow. It causes a little bit of degeneration of the muscle tissue, which is why your nerves get aggravated around a trigger point. And so when you release a trigger point, those chemicals disperse. And then it helps to bring a little bit of pain relief to that area. And then the third reason is that trigger points can lead to postural compensations and changes. So if you have a painful shoulder due to a trigger point, you might keep it a little bit higher in order to keep it nice and safe. Or if you have one at the bottom of your foot, it might change the way that you're walking. So if we can help reduce some of that pain that's along your body, then it can lead to a little bit better function for you and yourself. All right, and then there are many other ways to release trigger points as well. We're going to talk specifically about the tennis ball tonight, There's also a tool called the Theracane, which is a firm plastic tool. It's ginormous. It's shaped kind of like a shepherd's crook, and has some bulbs on the end of it. You can use that the same way you hold the bulbs over the tender spots along your body. And then another way is positional release therapy. We use it here in clinic quite a bit. For this one, you put the tissue in a shortened position, and then we hold it for about 1.5 minutes. And so that's another way we can release the trigger points. Continuous pressure, so just like holding in and digging in for a little while, and then reducing different lifestyle factors as well. So if you are an avid runner and the side of your IT band is completely lit up with trigger points, we might recommend a decrease in activity for a little bit as we wait for things to heal and calm down within that area. All right, so I forgot to mention at the beginning, but if you have any questions, go ahead and put them in the chat box, and then I'll address them at the end of our time together. All right, so here's some tips and tricks for getting a good trigger point release with a tennis ball. If you don't remember anything else from tonight, I want you to walk away with: you are in control of how much pressure you're applying. You are in control of the way that you're moving. You are in control of finding what your body needs and how your body best responds to it. So what we're looking for is to feel a hurts so good feeling, not a hurts feeling. When pressure is applied to a trigger point, it's going to cause a little bit of symptoms just because it's already an irritated spot. And so when you apply a deeper pressure to it, it's going to increase a little bit in symptoms before they resolve. You'll know to be able to stop lying on the tennis ball once those symptoms go away. It kind of feels like a melting sensation. And then the hurts feeling means that you need to change position, or you might be applying too much pressure, or your body may just not be ready yet for that position and that form that you're using. So remember, we're looking for the hurts so good, not the hurts feeling. All right, so then there's multiple different ways and tools that you can use to help your body find the exact right position. Some of the ways that we're going to look at is using body position and body weight. So you can lie flat on the ground, and then you place your body on top of the tennis ball. And then you can vary your body position based off of that to apply more or less pressure. Another way, as I mentioned before, is using socks or pantyhose. We have a little bit of compression stocking here with us. And so you can use these to hold the balls. And then also, if you have a sock, you can tie a knot in the end of it to make sure that everything stays in place. You can also use a pillowcase to fling over your back or place under your legs if you're standing against a wall. If lying down isn't comfortable for you, you can always stand against a wall or sit in a chair. And then use the pillowcase to kind of direct where you're applying that pressure. All right, so as you apply pressure, it'll probably take about 2 to 3 minutes for you to feel that melting sensation. So go ahead, set a timer, at least wait those 2 to 3 minutes before you decide to completely give up on that spot and try a different spot. As a release is happening, feel free to move the ball around to kind of maintain that appropriate pressure. Remember, that hurts so good pressure. All right, so we just got done talking about holding it for 2 to 3 minutes in order to feel that right release. And then afterwards, it's important to move the area that you just helped release to orient the tissues to their new and less restricted position. So let's say that you do a trigger point release on the bottom of your foot. Then afterwards, after you feel that release, after you feel that pain relief, go ahead and move your foot up and down about 10 to 20 times to kind of reorient those tissues to their new position. if you want a stronger effect with trigger point release, go ahead and do it after a workout or after a long walk or after a long run. Warm tissues are more pliable and they respond better to stress than cold tissues or tissues that haven't been being used at that moment in time. And then lastly, drink water, because like I said before, those active trigger points release chemicals. So in order to help kind of dilute them and flush out your system, it's good to rehydrate, add a little bit of water, and just let your body do what it does and clear out your system. All right, so that was step number 1, talking about trigger points. It's the first way that we can use a tennis ball. And then the second way is with coordination. Coordination involves a lot of different things, but mainly it's coordinating the activity between your muscles, your nerves, and your brain, and how your sensory system processes everything. So really, that was a super fast breeze over, but that's kind of the system that we're working with. As we age, our coordination decreases. This can be because not trying challenging activities or spending a little bit more time relaxing. And so in order to kind of contradict and go against those negative effects, it's good to have a little bit of challenge every now and then. So today's coordination activity will be a little bit of a challenge. It even is for me sometimes, but you just do the best you can and give yourself a little bit of grace. So with coordination, it's involving motor planning and reaction time. It's challenging your balance. And like I said before, it requires multiple areas of the brain to communicate with each other. The specific kind of coordination that we're going to be looking at tonight is hand-eye coordination, which means that your visual system, coming through your eyes, has to coordinate with your muscular system. And like I said before, give yourself some grace. If at first you don't succeed, try again. And if it's not working with a small tennis ball, upgrade yourself to a playground ball or something that can help you learn the motion first, and then make it a goal to get to using a tennis ball later down the road. All right, and then my last tip and trick for you regarding anything, whether it would be trigger point release or the coordination activities, is to try to remember good body mechanics when you're squatting to pick the ball up off the floor. It's likely going to roll away from you at some point, so try to remember to pick up and reach with your legs instead of using your back to pick up things off the floor. If you have a little bit of difficulty with balance, try to kick the ball over to a surface that is stable. No wiggly TV stands, no cabinets that are not attached to the wall. We're talking solid pieces of furniture. And then so kick the ball over, walk over, and then use that stable surface to bend down, squat, and get the ball up off the floor. All right, so that was my beginning portion. Again, if you guys have any questions, please go ahead and put them in the comment area below. Now we're gonna move on to doing demonstrations on how to do the different areas. I have quite a few trigger point areas that I'd like to share with you guys. So I'll demo those. And remember that each of these can be done lying down, sitting, or up against the wall. If you do them up against the wall, you probably won't be able to get as much pressure as you would if you were lying flat on your back, but you'll still have a good effect. So the first one we're going to do, I'm going to go grab my foot. Isn't it a beautiful foot? Okay, so the first one we're going to do is we're going to apply a little bit of trigger point stress, a little bit of release to the bottom of the foot, to the plantar fascia. So the plantar fascia runs from the base of the heel and spans the length of the foot. And as you can see, the foot has a lot of bones, a lot of joints. That place on your foot can take a lot of stress. Fascia isn't soft and pliable like muscles or skin. It has a lot of tensile strength to it. And so that's another reason why it takes a little bit longer to allow a release to happen. And so for the best plantar fascia release, you can roll your foot over the ball until you find that spot that's a little extra sore, and then hold it there again for that 2 to 3 minute time. And then once you feel that feeling, that hurts so good feeling, and then it melts away like butter, you can go ahead and relax the foot, do those 10 to 20 motions. That gets the whole structure moving, and then you can move on to find some other place. The plantar fascia is often most sensitive right at the base of the heel. So imagine this lovely foot with skin on it. Here's the back of your foot. And if you feel along the bottom of your foot, you might feel a place where it goes from being hard to softer. Where it transitions from hard to softer, that's where you can put the ball in order to have the effect at the origin of the plantar fascia. That place is where it often has its most stress, and so applying the tension there could be extra beneficial for your feet. If you have any conditions like plantar fasciitis, posterior tibialis syndrome, these would be a good way to bring a little bit more pain relief to your entire ankle. All right. And then the next one we're going to do is we're going to do a release to the piriformis area and the general hip. So now let me go grab my pelvis. All right, so here is your pelvis. Believe it or not, it's shaped like a bowl, has about 2 bones here, and then you have your sacrum and your coccyx and your spine along the back. And so this entire thing is covered in muscles, inside, outside, up, down, all of it is surrounded by muscles. Lots of opportunity for tension to develop, especially if you might have a sore foot and you've been walking around a lot. That might have changed your gait mechanics, added more tension up throughout all the structures. So where we're going to be aiming to place the tennis ball is right along the glutes themselves. I'll demo for you in a little bit the exact position. That is super beneficial, but in anatomical terms, this is kind of where it'll go. Here's your sit bones here down at the bottom. Here's your tailbone. Here's the front of your hips at your pubis. So the tennis ball will go right about there. I'm going to step away from the camera for a little bit. I'll try to speak up nice and loud so that you can still hear me as I show you on the bed. All right, so you have your tennis ball, you have your flat surface, so you go ahead and lie on down, and then you place the tennis ball directly under your hip. You can lay your legs flat, and that'll get the glute max, glute med area most if you bend up your knee and let it fall out to the side. That pulls away the glute max and the glute med and allows the ball to reach deeper into the deeper rotators of the hip. So again, hold this one for 2 to 3 minutes and then bring your leg back up and try to use good mechanics to get up off the floor or get up off your bed. If the floor is too firm for you to use, then go ahead and try rolling on your bed. It'll be a little bit of a softer surface, a little bit less pressure coming upwards, and your body will be more ready to accept that pressure. All right, so the next one we're going to do is for your hip flexors. Your hip flexors run along the front side of your hip, so right along through there, and they perform the action of lifting up your leg. And so they actually sit inside the bowl of the hip, and so it takes a little bit of extra maneuvering to get the ball to this area. If you are pregnant or incontinent, go ahead and skip this one. You're going to be lying on your stomach and applying pressure to the lower abdomen, and so these are just some precautions we want to take while you guys aren't with us in the clinic. All right, so now I'm going to demonstrate for you guys the hip flexor release. So you go ahead and lie down on your stomach. You're going to find your belly button and then go 1 inch to the side and about 1 to 2 inches down. And that's where you're going to place the ball. You can make a fist with your hand and rest your hand on the fist to have more comfort. And again, if you don't find the spot right away, you can roll around on it to find that spot that gives you that hurt so good feeling. All right, and then the next one we're gonna do is for your suboccipital muscles. For those of you who work desk jobs or are students, this one will feel so good, I promise. If it doesn't, I owe you something, I guess, but I promise it'll feel really good. It's gonna go at the base of your neck. So you have these little tiny muscles that control this motion of your head. And they do a lot of work if you're sitting in front of a desk all day and your head is forward to your body, your shoulders are rounded forward, and then to see your computer screen, you have to lift your head up in order to kind of see what you're working on. And so those little muscles will be super tight, and lying on the tennis balls in that position would be pretty beneficial. So you put 2 tennis balls in a sock. The area between the middle allows for a safe space for your vertebra to pass through as you lie on top of them. So like I said before, they're going to go directly under the base of your skull. So you're going to feel a hard part, and then you'll feel a little bit of an indentation, which leads to your neck. So you're going to place the balls right at the base of your neck. And you can do this one against the wall or lying on the table. I'm going to show you this one against the wall. Don't mind my tallness. All right, so that looks a little difficult to see, so I'm going to squat down for you guys. And if you can't tell that the ball is placed directly right below my occipital protuberance, and it's resting right on top of those balls, or right on top of those muscles. If you need a little bit extra tension, I highly recommend, thanks Emily, I highly recommend doing this one lying down. All right, so we're gonna stick with this structure with our sock and our 2 balls, and now we're gonna take it to the rest of our spine. We just treated the top of our head, waited the 2 to 3 minutes, and now we can take this throughout the whole rest of the spine. So if you're lying flat on your back, you can place this down on the bed or on the floor and roll your body along it. Treat it kind of like a foam roller in that regards. The difference between this and a foam roller, though, is this hits exactly on your paraspinal muscles, which are the muscles that keep your trunk nice and tall and upright throughout the day. And then the foam roller doesn't have a nice divot for your vertebra as you roll all along the back of your spine. So I'll just demo that one for you guys real quick. And so it's going directly along my back. And you can perform a bridge to kind of help roll yourself up and down. And remember, it doesn't have to be the most coordinated. It just has to feel good. Find that hurt so good position. All right. Then we're also going to do another one for the neck. This muscle runs, it's called your levator scapula muscle, and it runs from the tip-top corner of your shoulder blade all the way up to the base of your neck. And this one can also get aggravated in individuals who spend a lot of time looking down at their phone or in front of a computer. So for this one, you're going to, again, lie down on a bed, place it directly at the corner, the top corner of your shoulder blade, and then you can lie down on top of it. Right at the top corner of my scapula, my shoulder blade. Oh, this one feels amazing. I love this one. And then you just hold it for 2 to 3 minutes. All right, and then the last trigger point release demonstration that I have for you guys is for your pec muscle. So for this one, you're going to find your sternum, which is the hard bone in the center of your chest. And so you find your sternum about halfway down, kind of close to your armpit. This is my armpit. About halfway down, you're going to come over to the center to the muscle belly. Your pec muscle spans across your chest and reaches all the way over and inserts on the inside of your shoulder. So if you're a female, this position might be a little bit more difficult to get into, but just move aside the ball and find the position that's most comfortable for you. So you'll find the center of the muscle, and then you'll lie down on top of it. So this one, you do have to be a little bit more comfortable with decreasing the pressure. It's a pretty sensitive area for most people. I'm even feeling that hurts so good feeling just applying the pressure through my hands with the tennis ball right now. So if you need a little bit of extra release, you can lie flat, lay down on top of it, and stretch out your arm to apply a little bit more stretch to that muscle itself. When you stretch out your arm, the muscle goes on stretch, which means that there's going to be a bigger stretch once you put an indentation into it as well. So I'll show you this one real quick. So again, you find your sternum, move over, find the muscle belly, and then lie down. You can use the fist in the forehead again. Find that position, get comfortable, and let your arm go out to the side. And like I said before, with that one, I definitely even felt a little bit of that hurt so good feeling with just placing it over with my hand pressure. So each body is going to be different. Just go ahead and remember that. Find the position that works best for you, whether it's standing, sitting, lying down, just straight hand pressure. You know your body best, so figure out what works best for you. All right, the next three things that I have for you guys involve, well, one of them involves coordination, the other one involves more posture things. And then the last one is a little bit of a surprise. So, regarding coordination, there's a couple different things that you can do with a tennis ball. Remember, we're talking about hand-eye coordination. So your visual system has to work with your muscles. The first one you can do is just tossing the ball back and forth. You can start with small tosses. Once you feel comfortable with that, you can go to big tosses. And then from there, you can work on speed, going faster. You can try to do super quick ones back and forth. And if you're really good, like Michelle, I heard she can juggle amazingly. You can try to add in a couple of different balls. I am not skilled in juggling whatsoever, never have been. I don't think I probably ever will be. But I can handle this one. All right, and then the next way that you can practice hand-eye coordination is by bouncing the floor or bouncing the ball against the floor, and then it'll hit the floor, bounce up, hit the wall, and then come back to your hands. I'm sure there's a mathematician out there who would love to tell me the angles regarding this and what's the optimum angle to return for your height. I do not know those. My best advice to give you is to keep trying until you find the position on the floor that works best for you, the position on the wall that works best for you, and to just not give up. Give yourself a little bit of grace again. So for me, I'm going to walk over to the wall now and show you guys. What works best for me is throwing the ball overhand, so up and over, and then aiming for a spot on the floor about 1 to 2 inches away. All right, so here you go, and I'll show you what I mean. So you throw it, hits the wall, and then it comes back to you and you try to catch it. So that's the goal. You can start by trying to catch with 2 hands, start by trying to catch with 1 hand then, and then that'll help your visual system coordinate more with your muscular system in order to bring about that coordination effect. So remember, you hit the floor, give it some trial and error, which helps people learn the best, actually. All right, and then remember, if you miss the wall and it ends up running away from you, or you miss the ball and it ends up running away from you, try to squat to pick it up, roll it over to that stable surface to help you bend over and pick it up. And then the second to last one that I have for you guys is a posture benefiting position. So you're going to have your 2 tennis balls within your sock again, and they are going to go along your mid back. So if you feel your shoulder blades, you can either go between your shoulder blades or directly below them, kind of along that position. So it's going to be pretty similar to the positioning where you were rolling all along it. And so you'll just hold this position though this time for about 5 to 10 minutes. So no phone time though. It's not a time to check your emails. It's not a time to text or watch TV or movies. It's a time to let your body relax and open up. So I told you already the back position. Your legs are going to be bent up, and we call that a hook line position. So your back is flat, your knees are bent up, and then your arms are going to be up and open to each side. This will allow your pec muscles to stretch and allow for chest opening and a little bit of back extension. So extension is this motion when it relates to the spine, and that's the motion that we're trying to have the most effect on. If you have conditions like osteoporosis or osteopenia, go ahead and skip this one as well. It might just be a little bit too much pressure for your system at this time. Or you can come in and ask us, and we can try to help you find the best position that works for your body. All right, so I'll go ahead and demo that one for you. So again, place the balls along your mid-back, and then you bend your knees up. Let your arms go out to the side, palms facing up towards the air. And you just let this hold for 5 to 10 minutes. You can practice deep breathing techniques here, breathing from your diaphragm, allowing your whole chest to open up. I wouldn't recommend falling asleep there. It might be tempting, but try not to. All right, and then my last recommendation for you guys when it comes to using tennis balls is to be creative. As I've mentioned multiple times throughout this session, you are in control. You know what your body needs. Have fun. Explore what your body needs to. Get to know those needs, and then get to know how to treat them yourself. So find the specific trigger points within your body. If you have any questions on how to reach a specific area based off of your needs, what positions are comfortable for you, which ones aren't, come in and speak with us. We'll help you out, I promise. And then here are some examples on ways that you can get creative. Go ahead and play catch with your dog. Play catch with your friends, your significant other, your child. It's an easy way to do some of that hand-eye coordination, those activities. You can also add the tennis ball to a travel kit. It seems apparent that there's more people who are going out and traveling a little bit now that COVID restrictions are dwindling down a little bit more, and so more people might be traveling. Traveling means a lot of sitting time, a lot of sleeping in beds that aren't your own. Go ahead and add a tennis ball to your travel bag. Along with adding a tennis ball, you can add a scarf. Whenever you sit in air conditioning, and if you're a person who gets cold super easily, your body is going to raise the upper traps in order to try to keep you nice and warm. It tries to warm up your core. And so in order to help keep your upper traps down, you can wrap a scarf around your neck to keep you a little bit warmer. And then you can also use the scarf to roll it up and give yourself a nice lumbar support. If you have a little bit of an uncomfortable plane seat, because let's be honest, they really aren't that comfortable, and you can have a little bit more of a comfortable flight possibly. And then another way, or another thing you can put in your travel kit is an air pad, which would add a little bit more comfort to the seat that you're sitting on. Those can go on cars, they can go on planes, and they won't add significant weight to the pack that you're traveling with. And 3 more things to add to your kit, actually 2 more things to add to your kit, is just one TheraBand. Almost anywhere that you're going is probably going to have a door, or if you're camping and going on an adventure, there's going to be a tree, possibly if you're not going to the desert. And so you can use TheraBands to help open up your chest if you've been sitting all day. Do that bilateral external rotation, or you can do those scapular retractions. We talk a lot about those in clinic. They're good for just engaging the upper back and asking that to fire appropriately, getting those shoulder blades to do exactly what we want them to do. And there's so many other things that you can do with TheraBands. You can put them around your knees and practice doing squats in the hallway. Wave to your hotel neighbors and be like, it's PT, it's okay. And then the last thing you can add to your travel kit is rubber bands. If you have a towel, if you have even your scarf, you can place the rubber bands around a rolled up towel, and you can treat it kind of like a foam roller. And then you can do any of your normal foam rolling exercises on it as well. All right, well, friends, that is all that I have for you. If you guys have any questions, go ahead and let us know. And if we don't address them now, we can address them at a later time. We hope to see you guys around our clinic. And feel free to like our Facebook page, and then you'll be able to see more of our videos, more of the things that we can share with you guys. And I hope that you have a fantastic evening. Bye, guys.